Yes. Here is your question.
Hmm.
Yes, you can take your time and you can read. Once you've read the slide, tell me, I'll go next.
Okay, next. This is just an instruction.
Yes.
Call it. Okay, ma'am. Next one.
Yes, yes.
Okay, ma'am.
Right. So if you have read and understood, considering it communication skills station, kindly please begin.
Okay. Hello, sir. I am Dr. Mahmood, one of the surgical senior house officer here. So, can you confirm, am I talking to the trauma surgeon?
Hello, yes, Dr. Mahmoud. Continue.
Okay. Okay, sir. So we have a 20, I forgot the age, is a male patient who 20 years old male patient who came to us with the history of a road traffic accident. He was a motorbiker. Then on examination, the patient was initially unconscious. Initially, the GCS was 15/15 on arrival, but now the patient is unconscious. And then on examination of the abdomen is distended, rigid. And then he also have open fracture of the tibia fibula. So we did some investigation. We did ultrasound of abdomen, which shows some free fluid on the paracolic gutter. We did X-ray, which shows a right tibiofibular open fracture. And then we did some blood tests, like CRP is high. All other tests are unremarkable. On examination on the leg, now I feel the patient has very cold and pulselessness of the right lower limb. So I'm updating you about the patient. This patient might need operation from our general surgery side and orthopedic side as well.
Okay, is the patient dehydrated?
Okay, I didn't check. I will check the patient and then I will get back to you. But we already started IV fluid of the patient.
Okay. Is the patient wearing C-collar?
Sorry, sir, I didn't check that one as well.
Okay,
But I
please
will
check for
check and I
that.
will get back to you.
Please check for that. Okay.
Yeah.
What's the most urgent for the patient?
So now the patient has a very cold, calm right lower limb with there is no pulse. So I think it's a vascular injury of the right leg. So I think that one is urgent. And also the patient is having some free fluid in the abdomen, and ultrasound shows free fluid in the paracolic gutter. So that one is also patient need laparotomy as well.
Okay. So
And on the same time, if the patient is having open fracture, maybe we can inform the orthopedic surgeon, then we can fix that fracture with the external fixation as well.
So what's the cause of pulses of the foot?
I think it's a vascular injury due to the open fracture.
What else?
And my other differential could be a compartment syndrome, but as the patient is having a open fracture, that is least likely.
Okay, so what's the investigation for the patient?
So we did a blood test. So most of the blood tests are normal. Only the CRP is a bit high, C-reactive protein.
So the patient now with fractures and pulseless. All right.
Yes.
Okay, at what classification of NC-POD now the patient?
So now we can see the patient is having a pulseless knee limb and open TP fracture. So we can say is a Gustolo Anderson type, maybe 3C.
No, I ask about NC-POD classification. Is the
Sorry?
immediate or urgent? The patient at
Oh,
NC-POD,
okay, I think
it's
it's an
urgent or
urgent.
immediate?
I think it's an urgent, yeah.
Okay, what's your plan of action?
So we already put the patient on IV fluid. We send for blood and cross match. We ask to prepare 4 units of blood. Then we have to inform the orthopedic surgeon. I have to inform the theater team and anesthetist as well, so that we can take the patient to theater for a repair of the vascular injury, and then, if possible, to put a external fixation, and then maybe possible laparotomy as well.
Okay, what are you doing for this fracture in the ER?
Because now, for me, I think the vascular injury is most urgent, so we have to take care of that one first.
So what you will do for the wound?
So for that one, I think we already put some pressure. I washed the wound with normal saline. So as the patient have a pulseless limb, so we have to take the patient to theater to fix that vascular injury.
So you will wash the wound, right?
Yes, we have washed the wound with normal saline.
So what will you doing for this fracture?
So for fracture, need external fixation, as is open fracture, but we can deal with it after dealing with the vascular injury.
Okay, are you doing external fixation in ER?
No, we have to call the orthopedic surgeon, but I think we need to deal with that vascular surgery first, then we can call them.
So we will not do anything for the fracture in the ER?
And I am not authorized to do that.
Okay. Who will you involve?
So we have to involve OT team, anesthetist, general surgeon, maybe orthopedic surgeon and vascular surgeon and plastic surgeon as well.
Okay, why plastic?
Because the patient is having a open wound on the on the right leg, so he might need a skin graft for primary closure.
Why for general surgery?
So general surgery, because the patient is having a free fluid in the paracolic gutter, and he has some laceration, abrasion on the abdomen as well. So he need laparotomy, and patient might have a compartment syndrome. So we need maybe fasciotomy.
Very nice. So what is the management of free fluid in the abdomen? How's it told me?
Sorry?
What's the management of free fluid in the abdomen? You are already
So
answered
if
this.
the patient is stable hemodynamically, then we can send. Okay, initially we have to do a first, which is done in that case. And after that, if the patient is hemodynamically stable, we can do a CT scan to rule out the cause of bleeding inside. Or if the patient is hemodynamically unstable, then we have to take the patient to theater for diagnostic laparotomy.
Okay, why you are calling me now?
So to inform about the condition, as you are a head of the trauma team, and as we need to operate the case, so to inform you.
Okay, can you summarize my recommendation, please?
Okay, sir. So we have a 20 years old male patient who came with a history of road traffic accident. He was a motorbiker. He came with low GCS. So we have to do a CT scan head and CT scan chest abdomen. And then we have to call the vascular surgeon. We have to call the general surgeon and maybe the plastic surgeon. We have to inform the theater team and anesthetist and orthopedic surgeon as well. Patient need the vascular surgery first, then we can go for maybe exploratory laparotomy or maybe external fixation and the wound care.
What's other recommendation I told you?
And you ask to check the patient is dehydrated or not, and the patient have a cervical collar or not. So
Very
I'll
good.
check and then I will get back to you.
Okay. Thank you.
Good. Thank you. Thanks.